Hey, this is Katya, and I'm so excited to share that this week's episode is brought to you by Avonlure. Avonlure creates indoor jungle gyms for homes and therapy spaces. I have 2 Avonlure sets within my clinic space, and I can tell you they are the most used item at Total Spectrum Speech. You can get 10% off their entire site with code BOHOSPEECHY. That's BOHOSPEECHIE. And you can find the link in our show notes. And while I have you here, I'm also going to direct you to bohospeechy.net, my website where I have Gestalt language processing handbooks as well as a variety of short courses on Gestalt language processing available. All right, thanks, and let's get into the episode.
If you don't have trust with a child and that child can't confidently and consistently tell you no when engaged with food, don't start feeding therapy. If you haven't built a relationship and if you don't know their no and honor their no, you have no business going there.
In today's episode, Nicole and I are joined by Erin Forward. Erin is a speech therapist and certified lactation consultant at a children's hospital. She has advanced training in pediatric feeding disorders, early language, AAC, and trauma, specifically for medically complex children. She's also a DIR floor time provider and a TBIR trained practitioner. Erin is also a regular co-host of the First Bite podcast with Michelle Dawson. On top of all of that, Erin also educates other therapists on trauma-informed feeding therapy in her course, Nourishing Connections. I had the pleasure of being in her last cohort of the Nourishing Connections course, and it was truly incredible. You can sign up now for her winter cohort at the link in the show notes. In this episode, we discussed her idea of mealtime literacy, trauma-informed therapy, the emotional aspects of feeding, the 3 C's of feeding therapy: comfort, connection, and curiosity, what to look for in trauma versus not trauma-informed therapy, dealing with the stress of your child not eating, medical diagnoses that might underlie feeding challenges, and more. Erin shared some serious knowledge in this episode, and we cannot wait for you to hear it. Welcome to the Great Language Partner podcast. I'm Katya.
And I'm Nicole. We are 2 neurodiversity affirming speech therapists on a mission to bring joy to your autistic child's communication journey.
Separately, we've helped hundreds of neurodivergent kids become confident communicators, but we know we can make an even bigger impact together. Whether you're a parent or professional, we're here for you as you navigate your unique journey.
We'll talk all things Gestalt language development, sensory processing, and beyond as we share practical tips and inspiring stories to help you become your child or student's greatest language partner.
Let's create a more understanding, supportive, and affirming world for autistic kids.
One conversation at a time.
Nicole and I are here with Erin Forward, and we are so excited to chat mealtime literacy and all things feeding therapy. Hi, Erin.
Hello. Thank you all for having me. It's weird being on this side.
Yeah.
I'm like, I'm not used to the one being interviewed. Yeah.
You have your own podcast?
Yeah. So I am the co-host of First Bite podcast with Michelle Dawson. We've been doing it for 6 years now. So it's been a minute. I think we're almost up to like 2 million downloads, which is insane.
Congratulations.
But
yeah, that's
thank
huge.
you. It's so fun. Like I feel very lucky because I was Michelle's student, and I remember I was listening to the Swallow Your Pride podcast actually, and I was like, Michelle, she lectured always. I was like, you should do this for peds. And she was like, I'm only going to do it if you do it with me. And so initially it was like me interviewing her because I was a student and I didn't know what I was doing. And then it's grown into like us doing them together, me interviewing people. And we've just met the most amazing people. And I feel really lucky to have been like mentored by her through it, because otherwise, like, I don't know where I would be.
Yeah. Yeah, that's really awesome. And 6 years is a long time to keep up with a podcast.
We took like a 2-month break the past 2 months, but other than that, I think we only took like a week or 2 off. So
Wow.
it's
That's
been like
incredible.
almost 250 episodes. Yeah.
Wow. And what do you mostly focus on your podcast? What are the topics that you talk about most often?
We started more feeding because that's kind of what Michelle and I love so much. But I mean, everything peds, like AAC, private practice. We have physicians on too sometimes to talk to them, or like nonprofits that are, building awareness around certain resources. Like basically with Michelle and I's ADD, like if we have a like idea or
Yeah.
something irks us, we're like, let's bring somebody on to talk to about this
Yeah.
because we can't just be living in our own head. And so that's kind of
Yeah.
where a lot of that has come from.
I think we can resonate with that. Resonates with Katya and I. It's kind of why we
Yeah.
ended up here.
Yeah,
That's
absolutely.
cool. So I guess we'll kind of talk a little bit, if you can tell us a little bit about kind of what you've been up to and this mealtime literacy topic, which you share about a lot on social media, and I'm sure is kind of a new topic for our listeners and us. So tell us what that means and what it has to do with supporting our neurodivergent kids.
So I feel like I have a weird path to where, I mean, everybody has their own journey of how they've gotten where they've gotten. And I went into speech actually for augmentative communication because I worked at a school for autistic kids and kids with multiple disabilities and just fell in love with access to communication. I specifically remember a little boy I would sit with at lunch, and he used his device to ask for garlic powder every lunch. And once the garlic powder dissolved, he would ask again for more garlic
My
powder.
kind of guy,
And
for sure.
yes, and it was a school in Pittsburgh that has been around for like 100 years. They had prom, and kids would use their communication devices to ask kids to prom. And I was like, this is magical. I love this. This is what I want to do. And then when I was in grad school, I met Michelle Dawson and also fell in love with feeding, which I did not think I would love because I thought I would think it was gross.
Yeah.
But it's not. And so I had this love for medically complex children and working with feeding and augmentative communication. And then I worked at a nonprofit in Greenville, South Carolina, and started to see a lot more autistic kids. And while I was doing that, I met my now best friend and we lecture together. She's an occupational therapist. And we started seeing clients together, and we would kind of pick each other's brains. And I'm a very like, I feel it. And she's like the most brilliant person I know. And I'll be like, I feel this with this kid. And she's like, oh, it's because of this theory and this motor plan. And like, she can just list it off. And so we shared one specific patient. I will never forget him. And he kind of introduced me to floor time. And I remember one time she brought up DIR floor time. I was like, what is that? She's like, well, it's kind of what you're doing, but the DIR gives you this framework for why you're doing what you're doing. And so I started to go taking floor time courses, and it just made sense. It was like, oh, my gut is right. Like what I'm feeling I need to do with these kids is what actually neurobiologically they need from a relationship-based standpoint. And it just the doors that opened and the magic that I saw with these kids, like the patient that I will never forget came to our session one day with a piece of paper, and it took us an hour, but we were able to get him to turn into the Pixar lamp based on the hour of us working together, because he also was a praxic. And so just being able to help kids like be who they want to be. I use this metaphor of a tree. Like you can't turn an apple tree into a cherry tree. And so what the therapy we were doing before was trying to change who kids were. But the only thing you get with that is not seeing the fruit of who they actually are. You just get a tree without the cherries or without the apples. Every tree needs different fertilizer, water, sunlight, and we have to work to figure that out. And some trees aren't planted in the best space for them. And so they might need more support. We might need to build a greenhouse. We might need to do things like that. And the trauma, because I'm also trained in trauma-informed care, are the rings. Like we don't see it always, but we know it's there. And I'm not going to chop a tree down to figure out what their trauma is. And so when I started to really fall in love with the autistic kids I worked with, and I had this feeding background, but the type of feeding therapy I was seeing did not feel good. And I had all these parents say, it would be a year, 6 months of me working with them, and they'd be like, yeah, feeding's always been hard, but we just thought they couldn't help us.
Yeah.
And so when I started to take floor time and play and how kids learn and make connections and bring it into feeding, I was like, oh, the fact that we expect children who have challenges with motor planning and their communication and engagement to sit at a table and tell us what food they like and don't like,
Mhm.
to have posture control, to listen to all the sounds at the table, and just think that that's just something that's gonna be easy for them is blows my mind because feeding is so challenging and so intimate and so emotional. And so I the idea of mealtime literacy came from this because I used to use the term food literacy, which is more of a like, what is food? Is food healthy, unhealthy? Which is not I don't like to talk about whether no food's good, no food's bad.
Yeah.
But mealtime literacy, I would use this with parents of like, what is their understanding of mealtime, but the mealtime they want? Like, I don't want this to be a neurotypical mealtime literacy. This is a what do they want mealtime to look like, and how do they learn about food? If a child is their mode of playing is that they really like to throw things right now because they learn about it. I throw it. This makes a noise. This doesn't make a noise. This bounces. This doesn't. This feels heavy. This doesn't. Guess what I'm probably going to do? Throw food. And
Mm,
some people think that's crazy because they're like, oh, you're going to let them throw food. They're going to throw food everywhere. They don't
They
actually.
don't.
A lot of it is this is how I'm learning about something. And then
mhm.
the foods that are more comfortable, I can maybe sit at the table and engage in that routine that we've created that has less praxis, that I understand what's going to happen. But it takes time. Like you have to learn about that child and you have to build trust. If you don't have trust with a child and that child can't confidently and consistently tell you no when engaged with food, don't start feeding therapy.
Mm.
If you haven't built a relationship and if you don't know their no and honor their no, you have no business going there. And so when I started this course, this term mealtime literacy became a how does this child want to learn about food? How do they feel safe learning about food? And then if they can take that schema almost of learning, they can carry that to other environments. Whereas if I just get a kid to try a new food in my um, clinic room or setting, that's not necessarily going to carry over. And that's not the important piece. And so I broke it down into these three components of connection being first, like connect with that child, learn about that child, help them feel safe, know what their safety looks like from like do I actually understand what safety looks like? Because it looks so different in our neurodivergent kids sometimes.
Mhm.
Sometimes when it looks like they're feeling safe, it's them just shutting down. And that
Right.
happens a lot at
Yeah.
mealtime.
Yeah.
And then building comfort, like, is it safe for them to eat this? Medically, is it safe? A lot of our neurodivergent kids have medical complexities that are because of challenges with interoception. It's really hard to piece those apart. And then do they feel comfortable with the routine? And then that's when you have curiosity, which is that third component. If you aren't comfortable and you don't have connection, Jillian Bordeaux, I think is her
Bordeaux.
last name.
Yeah, Bordeaux.
She always talks about, I just interviewed her. She always talks about, she said curiosity is a luxury cognitive process, which I thought was
Ooh, I
interesting.
love that.
You don't get curious until you feel comfortable. And so if we're not helping this child feel safe and comfortable at mealtime and then we want them to try a new food, get out of town. Like that's not happening. And it's a challenge, as you guys know, the type of therapy, child-led, play-based, honoring their strengths is incredibly challenging, but like our kids deserve that. And so you have to give yourself patience and time. And that's what I'm trying to like build this framework of like, help them learn, help them advocate for what they need and what they don't want, and understand families too. Like a lot of my job is just to be like, I get where you're coming from.
Yeah.
You are not crazy. This is really hard. When someone tells you, why are you letting them eat this or making an extra meal for them? Tell them nicely and in words
We're not.
that it's not their business. Yeah. Yeah. It's just, I work at a hospital. It's an amazing hospital, but the amount of times I get told I don't know what to do with this child breaks my heart because it just takes time and patience.
Yeah. Yeah, and I love that you're starting with that time and patience and safety piece of it, because whether it's feeding therapy or language therapy or AAC or anything, when it comes to supporting autistic kids, it really has to start there.
Mm-hmm.
Erin, do you notice something that is kind of coming up for me, and I bet others as well, is like a lot of the parents that come to my clinic now with their autistic child are kind of like same age peers to me. And so we were all kind of
Mm-hmm.
raised in a time where like we didn't really get to do what we needed to do to regulate ourselves, and we didn't have that kind of luxury like you and Jillian describe of, you know, coping and feeling comfortable enough to do something. We were just told you do it or you go to your room, or like you eat what's on your plate and then you or you don't eat. And so for a lot of the parents that come to me now, they'll say things like, maybe it's not about eating since we don't really focus on that yet. But now talking to you, I'm like, we're going to start. Is that they'll say, well, I just don't think I should let them throw their toys because you're not supposed to throw your toys. And I'm like, says who? And they're just like, I'm like, we're the adults now. So we get to decide. And when you have a child who is learning differently or whose brain is understanding things differently, like you can't just use the same way. And they, like you said with food, when you let them throw things in therapy to play and you let them explore and be curious to do those things, they don't just go around chucking things at people. Like that's not how it works. They're learning that way. And so it's not about just being like, super permissive and letting kids just get away with anything. It's like about respecting them and breaking our own chains of like the things we were taught. And so I always think that that's powerful when a parent will say, well, I can't let them do this. And I'm like, because what? Who's going to
Yeah.
tell us no? We're the adults now. I'm giving you like the reassurance. And so it's really interesting to hear you talking about that. And I'm sure that comes up a lot in feeding therapy as well.
Yeah, and feeding is, like I said, is so I think, you know, I always say occupational therapists have this really broad scope because activities of daily living is so broad, but feeding and communication are intimately tied to our entire day and everything that we do. And feeding is also, to your point about talking with caregivers, like, we also grew up in the era of, you know, granted, the diet culture is making a strong comeback right now, unfortunately, and it's rebranded like nobody's business.
Yes.
Um, but we grew up in that culture of slim fast and Atkins, everything that, make your body smaller and, you know, that was a sign of worth and foods, and don't even get me started with social determinants of health and our lack of understanding of what access people have, and you have to be aware of that as a feeding therapist. Like, am I recommending a food for you that you can't even get access to on WIC and you're on WIC?
Right.
Like, we have
Right.
to be aware. But so for
Right.
a lot of caregivers I work with, it's like they have their own challenges too of like, my child only eats processed foods and I'm just so worried about their nutrition and what people are going to say, and I have a hard time because I don't feel that this food is healthy, and we also forget how we talk about food. And so even if it's not directly to that child, are they picking up on things? Are they picking up on our tone? Is that causing more anxiety? And it's feeding is such a relationship based piece too, because I used to work in the NICU. I work with a lot of families post NICU, and we know that our autistic kids, even as infants, respond differently to that relationship and cueing and may not want to be held in the same way. And so it builds this, their attachment isn't building in the same way because of the way that they're expressing their needs, and caregiver maybe not reading that need because it's so different from theirs, and their sensory needs are vastly different as well. And that goes into feeding. So when this attachment and this relationship back and forth isn't going in the way that we expect it to, I'm refluxy, I'm uncomfortable, my sensory system is out of whack, I'm not reading your facial cues in the same way, or it's too much because I can sense your anxiety. It goes over and over and over, up to 18 times a day if you're breastfed. And so now we're coming as a child later on, and they found these foods that feel safe, and maybe that engagement is really difficult, and so we have to rebuild this relationship as well around food. Sometimes I have a goal that I just want child and caregiver to experience some sort of joy at mealtime, because they're building this now secure attachment around food. And that may not always happen. The caregiver may not always be ready, but I'm always thinking about the caregiver as well. I'll write goals for making sure the caregiver acknowledges that child's refusal cues, curiosity cues. Like, are you reading your child? Because a lot of times, unfortunately, I get, and I'm sure you guys do, have patients who have had other experiences with therapy.
Yes.
So caregivers were told certain things to not honor their cues, to ignore them, to, not build this relationship. And so it's a lot of like also working backwards. And what I will say to caregivers is we're building new neural pathways. Like, we're building new neural pathways and positive experiences around food. And you may not see the progress necessarily initially, but those are happening. Every time you have a positive experience around mealtime, food, talking about food, that's a win. That's progress. That's huge. But if feeding goes negative, we've lost them a little bit, like neutral to positive at best.
Yeah.
And it happens sometimes, but we try to be cognizant of that.
It sounds like a lot of your feeding therapy is just building positive relationships with food and playing with it and kind of exposing without doing exposure therapy.
Mm-hmm.
But you talk about how we want to avoid those negative moments around food. But I feel like I've seen feeding therapy that does not feel good for the child at all. And I don't know a whole lot about feeding therapy, but I can tell that it's probably not building those positive moments. I'm curious if you have insight on maybe what to look out for when it comes to feeding therapy that might not be so affirming.
Yeah. And there's a lot of it out there, unfortunately, because feeding also, and I can sympathize with caregivers of like, you want to feed your child. I'm supposed to feed my
It's
child. And
stressful.
this
It's a
is
stressful thing.
so traumatizing. And so,
Mm-hmm.
Jillian and I also talked about like, it's so hard because you're so anxious because you want them to eat. But
Yeah.
when you're anxious, their digestion shuts down because they're so
Yeah.
stressed. And so for a lot of kids that are maybe failure to thrive or having difficulties gaining weight and families don't want a feeding tube, like, it is so hard to help a family slow down because our body is in fight or flight because like I'm genuinely worrying for my child and their nutrition and growth.
Yeah.
But what I try and teach caregivers also is to trust their child a little bit more. A lot of the feeding therapy out there, I think, goes on the basis of we can't trust the kids we work with. I have to make them do something. I have to genuinely, I've heard of and observed like children that have got feeding therapy where they are forced to eat it. And if they spit it up, they have to then eat it again. Like,
Yeah.
that is not it. And I'm holding something on your mouth and you don't get a toy until you get to kiss it, eat it, touch it. I just, the fact that that's still happening is just, I don't even have words for it because the other thing from a trauma-informed lens as well, we know that the children we work with are at higher risk for being taken advantage of
Yeah.
in horrible ways. Teaching a child that, and from a communication standpoint or a feeding standpoint, that they should put something in their body or do something that doesn't feel good is teaching them not to trust themselves. And that when that may happen again, like, someone's not going to listen to you. And so
Yeah.
if you're looking for feeding therapy, I think the biggest thing should be someone that honors a child's no and recognizes that. I spend some sessions just helping the child trust that like their no is okay. And our session may be 10 minutes the first time because they told me no. Guess what?
Mm.
They're going to be more likely to come back
Mm-hmm.
when I honor that and I work with a lot of children with a lot of medical trauma as well. And unfortunately, like, their lives were being saved, but they had a lot of touch that wasn't positive. They had a lot of experiences that they didn't want to happen. And so a lot of it is also our job is to peel back those layers and the barrier and the guard and the armor that they've built up. a lot of autistic kids come to see us and they have this armor
Yeah.
because they didn't trust the person that they were working with. And I will tell you, like, I've had kids, as soon as they feel better, I had a child that didn't eat for the first 3 years of their life, and as soon as their body felt better, it's great. They
Mhm.
started eating. That's not always how it happens, but
Yeah.
whether it's sensory or medical, what I like about the pediatric feeding disorder diagnosis that's newer is that it you don't you can have all they can either be medical, nutrition, feeding skill, or psychosocial. If you have differences in any of those areas, you have a PFD.
Mm.
And so it acknowledges that feeding is so all encompassing,
Yeah.
and you but it's not that child's fault, and we have to dig deep. Feeding is a lot of, as Michelle Dawson would say, chasing the swallow. Like, what is happening underneath? And I will also tell you, and I think this number is even high, only 3% of feeding disorders are behavioral. And I believe zero, to
Yeah.
be honest.
So,
Like,
Erin, can I ask you something? And
sure.
I don't know, if you guys can tell, but this conversation makes me a little bit emotional. Both of my kids got feeding therapy, and it was, I think, as a caregiver, as a parent, it was so stressful and so just and has nothing to do with the therapist. She was great, and she
Yeah.
was not using any of those like damaging strategies, but it was more about my own anxiety of like, just eat. Like especially with my son who is a toddler, and when he, refuses to eat something, or he's just being, difficult when it comes to eating, and he had feeding therapy for not being able to really chew. He has a tongue tie. Like, he's got a lot
Mhm.
of physical limitations to eating, but also there are times where I'm like, I'm at my wit's end, and you need to eat what
Mhm.
I put there because I'm not making something else. And it's like I find myself going into mealtime with just like already level 8 anxiety, where I'm like, if one person doesn't eat this, I'm going to lose my mind. And I know, as a professional and as somebody who is constantly trying to do better, that that's not a great way to start a meal, obviously.
Mhm.
I'm bringing a lot of the negative vibe to the interaction, and they feed off of me. And so I guess my question is, like, for parents listening to this who are like, oh shit, I'm actually probably adding to this trauma, which I can remember moments that I'm not proud of with my son, and saying like, just take a bite, and like literally like holding it up to his mouth and being, just bite it, just bite it. Like, I know you're hungry, you have not eaten all day. Like, I need you to.
Mhm.
And it's so layered. It's like, you worry that they're not getting the nutrition. You hear people being like, just put it on their plate, and like he'll eat it. I'm like, he's not eating it. And so I always empathize with the parents who describe their child and their really limited um diets. But I also think a lot of it, from what you've described and what many of us have experienced, is like, when we can like calm ourselves down and know that like, whether they eat or not eat at this meal is okay. Like, you're going to be fine. Because I think that stress is just like making it uneasy for everybody, especially for kids who pick up on that urgency, and then that sets them, back even further. So what would you tell parents? What would you tell other parents, aka me, for these kinds of complex feelings when it comes to feeding their kid?
Well, first off, I want to thank you for sharing, because I'm also very, like, I get very emotional. I cry with my families all the time because it is
Yeah.
so emotional. Um, and you can't be on all the time. Like, mealtime is a
Mhm.
intense co-regulation experience. Like, very in
Right.
like that is and then having all our own differences. I have had an eating disorder when I was younger, and like that, it lives in there. Like, I've
Yeah.
worked through it, but we all have our own experiences with food, and emotion and memory behind all of that, which is why I love what I do, because I remember Sunday dinner with my nana and papa that happened, and they'd make sauce and we'd sit there and we'd have this beautiful experience. But it it's not always positive. And so I try to help caregivers give themselves grace, number one, because it is so intense and we all can only have our cup be so full, and to also acknowledge, like, let your kid know where you're at sometimes. Like, I'm having a hard day. I'm having a hard day, and I know you're having a hard day. And I know that you you don't know that you need to eat, but I know you're hungry. And so I get that you know, I'm stressed too, but I'm here with you and we're both going to be stressed together. But what I will also say from, with the pediatric feeding disorder diagnosis, if mealtime is really, really, really hard, something is going on.
Yeah.
And the amount of caregivers that come to see me, and this is also unfortunate, that say, especially with our autistic kids, that say, something is wrong. I don't think he's comfortable. And the amount of doctors that unfortunately don't have enough knowledge and dismiss because they're not able to communicate. I had a child I worked with who he was non-speaking, had a lot of difficulties with regulation from a sensory standpoint, would hit his head a lot when he got really frustrated, and seemed to just be uncomfortable. Would only eat Chick-fil-A sandwiches. And in my gut, I was like, something is going on. I think you should see a GI, because he had been dismissed by other GIs before. Went to the doctor and had a really severe case of EOE, which is eosinophilic esophagitis, which is very common in our autistic population because of allergies. And essentially, it looks like rings in your esophagus. It's inflamed. It's really uncomfortable. It's an allergic response that moves up where our eosinophils aren't supposed to be in our esophagus, but they move up there. And so for him, every time he ate, it hurt.
Yeah.
Every time he ate, it hurt. And so when he would get dysregulated, is it my stomach hurts? Is it it hurts when I swallow? Is it I'm dysregulated? Is it too much noise? That's a challenge to navigate as a caregiver. How do I co-regulate that when some of it is medical and I have no control over it? And I've been wrong. Like, I've sent kids to doctors and I've been wrong, but I will say to families, I want to rule this out, because I don't want to push your child if they're in pain. And I have also talked to a lot of autistic adults that said mealtime was uncomfortable, and maybe, get diagnosis of EOE later on, had allergies, had gut differences. I'm not saying that's the answer for all of our autistic kids. It can be sensory, it can be, the emotional experience. But oftentimes if a caregiver is coming to me, and that's why they made this PFD diagnosis, because they wanted it to be, if something is challenging, if mealtime is stressful, let's support you to get the help that you need, to find a feeding therapist, to get to the right doctor, so that we can make it as easy as possible, because it should not be this challenging for the caregiver or the child. And it makes me so sad that it is for so many of these autistic kids. And that's also why I made this course, because I think in the past it's been, a feeding therapist, someone who specializes in feeding is the one that's going to see the autistic child that has feeding differences. I think also as a field, we've almost put feeding on this pedestal. Yes, you can harm a child if you make the wrong recommendations. Yes, you need to be aware of the medical differences. Yes, we need to understand aspiration. But it's also this child's doing this all day, it's multiple times a day. I feel like the clinicians that are connecting with the autistic children, that understand child-led, that understand play-based, those are the clinicians I want to try and capture and support, because I think those are the clinicians that can really help progress their feeding, because they know how to connect with autistic kids. They know how to build trust. And even just like starting to eat in your sessions, even if you're just having a snack. I'm just gonna have a snack. I'm not gonna bring it up. I'm gonna see if you're comfortable with it. That can start to build their interest in food if they trust you, because you're not pushing it on them. And also, these kids see enough different people. Like, I understand we all have our specialties, but like, having them see so many different therapists for so many different things, yes, is good to build connection with different people that have different sensory systems for kids. Yes, but like,
you know,
they're seeing enough people.
Yeah, they've got enough on their plate.
I empathize, like, feeding's hard, like, it is hard, I don't wanna make it seem like it's not, but I do think we need to be more open to different helping support people without making it feel like it's this untangible competency to achieve.
Well,
Yeah.
this is the first time I've ever remotely felt interested in feeding whatsoever. I'm like, well, actually, she's right. Why am I not helping my kids here that have feeding differences and challenges? Like, I'm the one that they trust. Like, why wouldn't I just
Mhm.
start there? I mean, in 10 years, I've never once thought, oh, I might be interested in feeding. I've always been like, ew, I'm not doing that.
Right,
Um,
we make it seem hard. It is
seems
hard,
so
but, like, it's
big.
not.
Yeah.
Mhm.
Mm.
Yeah, I appreciate that as well, because some of the clinicians at my clinic have been talking about diving into it, and I think we're all a little hesitant. So, yeah, I appreciate that.
Yeah.
And I also really appreciate you mentioning that when it comes to feeding, but also language and all these other things, that it's rarely behavioral. It's rarely the child being stubborn or picky. It's often so much deeper than that. It's often this hidden pain or things going on internally, because I know nothing about feeding therapy, but I'm so often pointing that out to parents, like, oh, he's suddenly banging his head or having these behaviors
Mhm.
that we haven't noticed. Maybe there's something going on, like you should take him to the doctor. So I know nothing about feeding, but I'm still always trying to help them
Yeah.
consider that there's almost always a deeper reason for these behaviors that we're seeing, and we can never seem to get deep enough, but it's all interconnected.
Yeah, behavior is all information. I mean, behavior is information. You're giving me information about what's happening. Using it you may not always be consciously using it as a communication. I mean, it is a communication, but sometimes my body does something and I don't know why it's doing it, but it's information for the person that I'm engaging with. I had a family I worked with. I remember the mom came in one day and she was like, he's asked how feeding was going because we kind of problem solve. It's not always something we do in the session. And
Yeah.
she's like, he's resorted back to a little more of his safe foods. Like he's not as curious this week. She goes, but I'm seeing so much progress in this other area. And I think maybe we're just progressing in this area. And he's just pulling back a little bit. And that's okay. Like we also have to understand that child holistically because it's not just what we're working on, that child is growing in that week. Like
Yeah.
we need to understand that it's all encompassing. And also some kids, and I will say this, some kids may never have that much joy with food. Some kids eat to live. And
Mhm.
like
Mhm.
those are kids where maybe we have to have conversations of like, what does this food do with my body? Like, what
Yeah.
is this food doing for me? Hey, how you have a headache and sometimes it's really hard at school because you have a headache, sometimes food makes our head not hurt. He may never be like, I really want to eat this because it tastes really good. It may be genuinely, I have a headache, I need to eat something. And that's also okay. We
Yeah.
have to take a step back of like our own neurotypical, I mean, I'm not neurotypical, but I engage in mealtime neurotypically. And
Mhm.
that's not what mealtime is going to look like for every kid. If a family comes to me too and says, mealtime is really important to us. I really want this child to connect with us at mealtime. I may have to say to them, feeding is really challenging at the table because of all the noises that are happening and because of him having difficulty with mastication and chewing, so it takes them a lot longer. If you really want to connect with your child, it may not be at mealtime.
Yeah.
Or if you really want your child to connect at mealtime, they may not be able to eat during that time.
Right.
Is that
Right.
something you're comfortable with? Like we also have to piece that apart and break down their goals.
Mhm.
Um, and that's part of our job too. Like I feel like a lot of younger clinicians too say like, well, the parent really wants me to do this, or they really need this. Part of your job as the clinician is also to say to the caregiver, this is what I'm seeing and this is why. This is what mealtime consists of. Help them understand their child. You're not just there to help them like progress their child. You're there to help them understand what's
Right.
happening
Right.
to better co-regulate and build an attachment. The language we use around mealtime, how I talk about a child, how I model language for a child directly affects that child's mental health and that parents and caregivers perception of who their child is. Like we have to take that and realize that's a heavier weight than maybe we understand.
Yeah.
What about when so this comes up in for me, and I'm sure both of you and a lot of people listening, and I'm like writing down notes because I'm like, well, I think there's a bigger picture here that we're missing, which is kind of what I always do. I'm like, I'm feeling
Mhm.
like all the pieces,
Mhm.
but so for in my clinic, what will happen is sometimes I'll notice, maybe this recently happened. I'll use this example. Recently, we have a child who is always has an open mouth posture. They're a loud, noisy breather. They snore. And I'm like, that's not really typical. And we don't, that could be leading to a lot of other things, right? Like we need to
Mhm.
make sure his airway is not closed or, and I'm not a specialist in that area, but I can recognize and refer, right? And that's my
Yep.
role there because the family trusts me. My biggest fear, because I've seen it happen so many times, is that I refer you to somebody and like you said, they dismiss you. And then it's like,
Mhm.
okay, well, that was wrong. I think that's the part that's infuriating for me as a clinician, but I can't even imagine what it's like for a parent. And I feel like we need to figure out a way to kind of create a network of people who are truly affirming and only refer to those people, because so far I've not found them. And I get families from some of the biggest hospital systems in our area who've taken their
Mhm.
kids there for therapy and thought, well, if I'm going here, it must be, world renowned because I'm taking you to the best hospital in the tri-state area. They must know what they're doing. But the kid can't tolerate the session because it's completely compliance based and it has no meaningful, like there's no connection, whatever. So they end up trying it, hating it, and everybody feels traumatized by the experience. Then they find me and I'm like, they're like, don't touch that. I'm like, they can do whatever they want here. They're running around the office, they're taking things out, and it becomes this like undoing of all of the damage that was done. And so whenever I like find myself in this position, I get so nervous. Of course, I always do it. I refer, right? But I'm always nervous that they're going to end up with whoever insurance tells them they can see. And that person's
Mhm.
going to be like, oh, they can't sit here for me to examine their airway. Well, then they're fine. Come back in 6 months. And like, when will that stop? Because we need to be educating these providers who are just letting it, like you said, there's a reason for these behaviors. No kid is going to just randomly start doing something for no reason. Like these are not
Mhm.
behavioral choices, right? These are signs of something below the iceberg. But it's like, damn, at what point will other people jump on the bandwagon, that we're not just these like loosey goosey speech therapists who like want everybody to have a good
Mhm.
time? It's like, no, we want to get to the bottom of this. Is this, we need to create this network, because now I'm like, well, we need to start having a directory for these people, because I'm sick of my parents getting defeated when they go places.
Mhm.
Well, it's wild that you say this because literally last night I was talking with a friend whose child has what she suspects is sleep apnea or suspected, and took took her son to multiple physicians, ENTs who were highly recommended, and they all just dismissed him because he's autistic, he can't do a sleep study, we can't do the things to really fully check it out. So, oh, he'll learn how to sleep through the night. And then eventually someone finally recommended someone that they knew was affirming, and they decided to do an endoscopy, which someone could have done 2 years ago
Mhm.
when he
Years
started this
ago,
journey.
right?
They tried it and they couldn't even get into his nose because it was so blocked, and
Mhm.
they fixed it immediately that day. Like,
Right. Like it's a quick
but
fix sometimes.
yeah, but if
Mhm.
we had, you're
Mhm.
right, if we had a directory of like, oh, we know this clinician is actually going to listen to your concerns and not dismiss you, that would be lovely. And, maybe with time that's something, but it's such a,
Mhm.
it's, yeah.
Yeah. I mean, that's something I learned from Michelle, my mentor. I mean, she um calls herself the squeaky wheel because even, when I worked in South Carolina in a lot of like did home health. So early intervention. So I would drive to a lot of people's homes that didn't have as easy access to certain medical care. And I would be the therapist that was calling the nurse at the pediatrician's office every week that I saw them, saying, I'm seeing this. I think this child needs a referral. These are my concerns. This is what I'm seeing, over and over again. And eventually my goal was to get as many doctors' cell phone numbers as I possibly could, because they would hear from me so much that they were like, okay. And I start to, kind of, Michelle always talks about like building your village and your community. And so a lot of it is finding those like-minded providers that will listen and will support these families. And it is really challenging, because I have had a lot of families that would go see a physician that didn't listen. And then you're kind of, do I trust myself? Was I wrong? Is something going on? But I always say to the caregiver, and this is when, I get this question a lot when I lecture, of like, okay, well, what do I'm worried, is the caregiver going to be frustrated because I'm saying maybe they should get a second opinion? And that's when I say to the clinician, like, be honest with that caregiver. Hey, do you feel, I'm still seeing this. What is your feeling? Are you comfortable going to see somebody else? If you're not, I totally understand. This is your decision. But I do, and I always say, mom gut has never been wrong for any of my patients. If any caregiver has said, in my gut, something is wrong, they've always been right, because a caregiver knows. And so it is being open and having those conversations. And, when I started to have like-minded providers, obviously I would say, you can go to whoever you want. If you are asking for my opinion, such as who I would take, if I don't have children yet, but who I would take my child to, this is who I've had a great experience with, because I want you to know. But it is definitely something we have to work on. I think in the medical field, we want to do the least invasive thing, is where they come from in that mindset. But unfortunately, for a lot of our autistic kids, especially our non-speaking autistic kids that are finding their best mode of communication, you can't always do least, because least invasive is wait and see. And they're giving us all the information. So that's, I think, a challenging mindset shift. But there's a way to be trauma informed with that. There's a way to make those procedures feel safer for autistic kids. Like, I've been working on a project of like making a video with narration of, here's the steps going to the swallow study. Here's what's going to happen. Here's what it looks like. Because a lot of it is just the unknown. A lot of it is like, you're going to put a tube down my nose and I don't know what this is. Of course, I'm going to pull it out. You didn't even tell me what was happening or show me pictures or explain this. And if I hear one more provider tell a child, it's fine, you're okay, when they're not okay, I will blow my brains out, because they know you're lying. Like I had one the other day,
undoing it. What everybody else is trying to do, you're undoing.
Yes, I had this mom who she had a speech therapist that was had wrote goals for this child who has a lot of medical complexities, also has an autism diagnosis. And she kept saying to the speech therapist, like, can we change the goals? These aren't working. And the speech therapist was like, no, he just hasn't met them yet. So the mom should not have had to do this, but called the insurance company and said, please do not approve this plan of care. It's not working for us. And she goes, when I see, when he gets his medical procedures, like, people think I'm crazy, but I look at him and I say, I know you're going to be mad. You do not want to do this, but we have to do this right now. And I'm here. And I was like, that's called co-regulation, because you're listening to him.
And it makes such a difference. And I think there's this underlying factor here that a lot of people may say that they are affirming, or they may believe that they are, or they may believe that they're presuming potential incompetence. But I think a lot of people at their deepest level do not believe that our kids understand, or that they don't believe that what we're doing to prepare them would make a difference. They don't seem to understand. And so I'm not going to show them this and tell them about it because, they don't understand. It's a waste of my time. And it's like, based on what exactly? Based on what? Because they can't speak yet, or because they can't speak, period? Like, so I think there's like this under the surface bias that a lot of people have, even with the best intentions. That's like, well, they don't understand. So we are just going to go ahead and do this and try to minimize the, outbursts that come with it. But it's like, something that comes up for me all the time is like, can you imagine if I'm misunderstood even for 1 millisecond? That sends me over the edge. So imagine being trapped in a body that you cannot get to cooperate, and people are just doing things to you, doing things for you, telling you what to do, and completely not even taking a second to think about what could be going on under the surface. Like, I'm telling you, if somebody misunderstands me once, I'm not happy. So imagine living like that 24/7 and then being expected to not have behaviors. Like, I would have behaviors. I have behaviors if my husband doesn't hear me from the other room and I have to tell him something 2 times. Like, so how are we expecting kids to just get a tube shoved up their nose with no issue? Like, that's, that doesn't even make sense. But we forget that kids are actually people and autistic kids actually are thinking and feeling and experiencing. And I think there's just so many layers to it that, a lot of us are probably trying to uncover, but it's difficult when not everybody wants to see it that way. And with the pervasive presence that is a behavioral approach in our society, it's like parents are given so many different, ideas and tips, and they're like, who do we believe? Like, I always just say, well, whatever feels right to you is probably the right thing to do. Like, none of us live with you at your home, so we don't know your kid like you know them. And I think a lot of what I do in my course, and it sounds like what you do, and I know what Katya does, is like getting parents back to listening to their own intuition, because they've now had however many years their kid's been in therapy. They've now had X amount of professionals telling them how to do every little thing, and they lose their sense of intuition. Like, you've had an early intervention provider in your house 3 times a week for 3 years telling you how to do every little step of your day. Well, their ideas and their suggestions become your own thoughts. And it's like, but does that make sense for you and for is that working? Because if that was working, we wouldn't be still talking about this. So let's just get back to ourselves. And obviously this is something that I get like really passionate about, because I can't even believe some of the things that parents tell me other people said to them. I'm like, I would rather jump off of my roof and into a pit of like fire breathing dragons than ever say that to somebody. Like, what is up with these? And so I think that all of this is like so intertwined, and it's just been so interesting to hear about how you're kind of approaching feeding with the same exact mindset as we're approaching language and GLPs. Do have one little question. I usually am good for like the deep, dark questions, but are we still saying picky eating? Is that still a term that's accepted?
I mean, I think that if you look at Feeding Matters, sometimes they'll talk about like what's picky eating versus problem feeding is something that's like been used in the past. I don't usually say, I mean, I think that children having like neophobia phases and food jags and things like that are all a part of typical development. So if we try and make sure, just to help make sure caregivers get the support that they need, in Feeding Matters has a really, really great resource on their website. It's 6 questions, and I've brought it to pediatricians' offices. It's great to bring to your pediatrician if you have concerns about your child's feeding, because the way they set it up is if you say yes to, I think it's 2 or more of them, they recommend getting just a consult or a referral to a feeding therapist, because again, we're having this conversation today too about like all the negative experiences building up, and the longer and longer that we have these challenging meal times, it causes more anxiety in caregiver, it causes more anxiety in child, and it just continues to build off of it. So that's why and I can sing Feeding Matters praises. They're a wonderful organization. They have so many resources. They have an app for caregivers. They have a like a mentorship program that caregivers that have been through certain experiences will work with other families to help support them, because, I mean, I can be as understanding and sympathetic to a caregiver, but like I don't have my own child, and I don't have my own child with a PFD or other diagnoses. And so I can't speak to that experience.
Yeah.
But that's why they created this, was because they wanted to make sure that families got the support that they needed, that they weren't feeling like it's my fault.
Right.
And because it's not. And I've had family caregivers that have come in and they've been engaging in strategies that I could label as similar to force feeding, but that they have no other choice. It's not their fault. Their child needs to eat, and they've been told they're autistic, so that's why it's difficult. And so it's also a lot of like helping them grieve the experiences that they didn't have, and the sooner we can get them to a affirming provider, which is the other challenge that we have,
Mhm.
but hopefully the better that we can work to support that relationship and that experience.
Yeah, thank you for that resource and all the knowledge that you've shared. It's been such a pleasure to chat with you, and we have to wrap up, unfortunately. But the last thing we like to ask is if you have any books or a specific book that has changed your views, maybe regarding this topic, and something that you would recommend to parents or listeners.
Honestly, my favorite book to recommend to caregivers is the book Play by Stuart Brown.
Okay.
Because I just love, like, that was the book that like I started to and if you're looking for like a heavier, more intense, the interpersonal neurobiology of play by Teresa Kessler, I also really love if you're more into the neurobiology. But I like that for caregivers too, because it helps teach you how to play. Like, it helps you understand like what it actually does for our brain, because I'm a little tired of like, where's the research behind play? And you're like, it's called neurobiology. Like, it's literally scans of our brain, like how our brain works. Like, it's not, I don't have a research specific study for like speech therapy play for, but
Right.
it's literally science. It is
Yeah.
science. And I think if as a person, I guess I'm giving you three, so I'm sorry.
That's okay.
Didn't, I'm
I'm
making my
going
own
to the
rules.
bookstore after this
Um,
anyway, so keep them coming.
for as a human that works with like um feeding and that relationship emotional, The Wisdom of the Body is one of my favorite books, just as a person, like the way it helps you, especially for women, and we're a female dominated field, like taking up space and how we feel about our body. And because a lot of this, the therapy that you guys do and that I do, I think is a lot of just like also taking a minute to check in with our body and how we feel, and if we feel safe, and do we,
Yeah.
because if you're doing therapy and it doesn't feel safe to you, it's not going to feel safe to the child. And
Mhm.
most often, like, I would get that anxious feeling when I was doing something that I was like, ugh,
Yep.
I don't like
So
this.
so true. And that's probably why many of us did not last long in the other settings, because we felt chronically dysregulated and uncomfortable, like seeing kids being, in trouble for like kid things and all of
Yeah.
those stressors that came along with it. You're giving me a lot to think about. I can't wait to listen to
Mhm.
this episode too, because I'm like, well, I haven't taken enough notes here, but I can't wait to actually go back to this and really take it all in. Where can people find your course? Are you still taking accepting new students? Is it something that's always available? Are you launching it again? Tell us a little bit about that and where people can find you also.
So I am Erin Forward SLP on Instagram. The podcast you can find pretty much everywhere. It's called First Bite Podcast. It's also on Speech Therapy PD for CEUs. My course is called Nourishing Connection. I'm starting a new cohort September 18th. So it will be available to sign up very soon. It'll be on my website, Erin Forward SLP. And then I'm going to start to do some like smaller courses, like shorter courses too. I'm working on like a neurodiversity affirming feeding goal writing course, just to help support that. Cause I think goals are so challenging, but also, when you start to be more confident in why you're doing what you're doing, they can be so, you can be creative with them. And I think we need to step out of the box too there. So I'm really excited. It's been wonderful to meet more people, and like I try to keep my course small because I do like office hours so you can ask questions, because it's a lot of information, and it's a lot of like I want people to be authentic in how they engage in feeding therapy. So what you take from it might be different than what somebody else takes from it.
Right.
And so I want to also be there to support that process of how you're interpreting the information and how it's working for your setting. So
Is your course geared towards professionals or parents, or can anybody take it?
right now it's geared toward professionals. I would love to down the road kind of support more caregivers in that way, because I think as I'm shifting my perspective too of like how clinicians can, helping more clinicians feel that they can support children in their eating and feeding journey. I want more caregivers to also feel like they can do that. But right now, yes. And it's I always say too, it's building a lens, because I get this question, I'm sure you guys do too, of like, well, what's your intervention? When are you going to start talking about intervention? My answer is always the intervention is in the theory and how you view that child. Like that's the intervention, but again, we have to shift. So it's mhm.
I can't just tell you what to do. I'm trying to explain to you how I do it and why I do what I do. I can't just, if it was as easy as giving you a checklist, a step-by-step guide, we wouldn't be here, right?
Mhm.
So yeah, I totally agree. Well, thank you so much, Erin, for sharing all of this with us. I'm telling you, these have been some of the best conversations, Katya. This has been so fun, and we really appreciate you teaching us new things and sharing with us today.
Thank you both. I could talk about it all day. So
Yeah.
I'm grateful to be here. I appreciate it.
Thank you.
Yeah, thank you so much.
I love to wake up